This is a first for us on Zoom. I hope all of you are still in your pajamas and you have a big cup of coffee and you're relaxing and you're ready for a wonderful morning. We are excited that this is our 14th annual event. We started this program in 2007 when we were still the St. Joseph's Women's Heart Center. In 2013, we proudly became part of the Emory family, and ever since then, this has been the Emory Women's Heart Center annual conference. Is a first and very innovative for us to be on Zoom. We hope that next year we'll have all your smiling faces in the audience and that we'll have some wonderful destination to meet in again. Many of you have been to many of these conferences, and so you know that we've done them at the aquarium, at Stone Mountain Conference Center, at the Botanical Gardens. We've picked some beautiful places in Atlanta to have our conference, and hopefully we'll all meet together in 2021 for the 15th annual. When we pick these topics, our Cme Committee is a great team. And when we picked these topics, it was actually in the fall. And we picked such timely topics for today. Diversity, equity, and inclusion is so important. Getting people in clinical trials, people are tuning into the vaccine trials like never before. The new innovations with TAVR, particularly in lower risk people, and the prominence of fatty liver and the role it's playing in our critical care patients. All of these are so important. But who knew we were going to have COVID-19? And more important, what an outstanding leader in Dr. Carlos Del Rio, and he's going to give us our keynote event on COVID and how it affects sex-specific and gender-specific outcomes. So we're very excited to have you all with us today. Quickly, I want to tell you a little bit about the Emory Women's Heart Center. Our mission is to educate women in Atlanta, but also educate physicians who care for women, to screen women, to do risk assessment, and most important, risk reduction. And we have 3 points to our program: teaching and education, research, which is led by Dr. Pooja Mehta, and then the clinical division. We're also very interested in preventive cardiology, and Dr. Isia Dinso heads up prevention at Emory, and so we're proud that she's part of our team. We also focus on cardio-obstetrics, cardio-oncology, cardio-rheumatology, and these newer areas of cardiology and how they affect women specifically. We also try to teach tomorrow's leaders. We're trying to recruit more women into cardiology. You may not know this, but a female cardiologist is more rare than any other subspecialty in medicine, and many of the surgical specialties as well. So we're trying to recruit more women into cardiology. We believe that by having diversity in our workforce, that we can better care for our patients. We have a project called the 10,000 Women Project, and I'm very proud to say we've already screened 1,000 African American women for this. We do this in the community, so right now it's on hold with COVID, but we hope to get started again next summer. I want to take a minute to thank our vendors. Even though this is not a live event, we still have vendor support, and I hope some of you have already gone into their rooms to chat with them. Every year this conference is financially supported by the vendors, and even this year we had tremendous support, and I want to thank Amgen, Janssen, AstraZeneca, Ombre Genetics, and Novo Nordisk Obesity. We couldn't do this without them. And importantly, I want to thank our Cme Committee, Sharon Baldwin, Diana Harmon, Dr. Isia Dinso, Stacy Jaskowitz, and myself for all the work that happens to get this program together.